Naitala na sa Pilipinas ang una nitong kaso ng
The Philippines has recorded 81 new cases of the
It's been 2 years since the global pandemic started, and ever since that day, many things have changed. And throughout those 2 years, global health initiatives have been implemented to make our lives much caught up with the new normal after COVID-19 happened. COVID-19 was one of the biggest problems we faced. Mandatory vaccination should be considered only if it is necessary for and proportionate to the achievement of one or more important societal or institutional objectives, typically but not exclusively public health objectives, which may also be in service of social and economic objectives. Vaccines are one of the most effective tools for protecting people against COVID-19. Consequently, some governments and organizations have made COVID-19 vaccination mandatory to increase vaccination rates. Discharge what are perceived to be duties of care to at-risk populations and or achieve public health goals. Others may be considering whether they ought to do the same, and if so, under what conditions, for whom, and in what context.
Wearing face mask is recommended as part of personal protective equipment as a public health measure to prevent the spread of coronavirus disease 2019 pandemic. Their use, however, is deeply connected to social and cultural practices and has acquired a variety of personal and social meanings. This article aims to identify the diversity of socio-cultural, ethical, and political meanings attributed to face mask, how they might impact public health services and policies, and how they should be considered in health communication. The analysis framed the 4 dimensions of the societal and personal practices of wearing and not wearing face masks, individual perceptions of infection risk, personal interpretations of responsibility and solidarity, cultural traditions and religious imprinting, and the needs of expressing self-identity. Our study points to the importance of an in-depth understanding of the cultural and socio-political considerations around the personal and social meanings of mask wearing in different contexts as a necessary and for the assessment of the effectiveness of face mask as a public health measure, improving the personal and collective understanding of citizens' behavior and attitudes, appearing essential for designing more effective health communication about COVID-19 pandemic and global crisis in the future.
Taking temperature and maintaining social distancing are both important measures in preventing the spread of infectious diseases, especially those that are easily transmissible like COVID-19. Taking temperatures is referring to checking someone's temperature can help identify if they have a fever, which is a common symptom of many infectious diseases. This can help identify people who may be contagious and prevent them from spreading the disease to others. It can also help in early detection and timely medical intervention. Maintaining social distancing is also important to prevent the spread of infectious diseases because it reduces the opportunities for close contact between individuals which can transmit the disease. When people stay at least 6 feet apart from each other, it makes it more difficult for the disease to spread. This is particularly important when people are in close proximity, such as in public places or workplaces. Both measures are crucial to help reduce the transmission of infectious diseases, and when implemented together can help to slow the spread of disease and prevent outbreaks. It is important to follow public health guidelines to maintain personal hygiene, wear masks, and practice social distancing to help prevent the spread of infectious diseases.
Through the COVID-19 Vaccines Global Access or COVAX facility, countries have the opportunity to benefit from a portfolio of vaccine candidates so that their population can have early access to effective vaccines. COVID-19 Vaccines Global Access, abbreviated as COVAX, is a worldwide initiative aimed to equitable access to COVID-19 vaccines, directed by the GAVI Vaccine Alliance, the Coalition for Epidemic Preparedness Innovations, and the World Health Organization. Alongside key delivery partner UNICEF, they are the ones that helps produce COVID-19 vaccines for the people throughout the world to prevent from causing the virus from spreading rapidly.
That you probably never lost. And I saw the peaks of my own that you probably meant for us. And I tore the fear from my bones that you probably never lost. But I would fake, I would hide, I would break every inch of my heart. But I would fake, I would hide, I would break every inch of my heart. But I would fake, I would hide, I would break every inch of my heart. Every inch of my heart.
Provide research training in population and epidemiology studies. Create training opportunities in mental health for medical residents and graduate students. Raise awareness and education about mental health stigma in population. Giving back the volunteering research suggests selfless acts of kindness help improve your mental well-being. They give people a sense of purpose and self-worth. They boost how good you feel about yourself and positively elevate your mood. Steps to mental well-being. Connect with other people. Good relationships are important for your mental well-being. Be physically active. Being active is not only great for your physical health and fitness. Learn new skills. Give to others. Pay attention to the present moments and be mindful.
And because of those health initiatives, our lives become much better throughout the global pandemic. We learned new things, we made new friends, and we thank God for always watching us.